I'm Dr. Asai here with a new sonography discussion on ectopic pregnancy versus corpus luteum of pregnancy. Don't forget to subscribe for every Monday new sonography discussion. Here we want to discuss how not to misdiagnose corpus luteum of pregnancy with ectopic pregnancy. So when we have a heterogeneous mass or cyst in adnexa, how can we understand if it's corpus luteum of pregnancy or ectopic pregnancy or other pathologies? First of all, check human chorionic gonadotropin HCG, not to misdiagnose other pathologies to pregnancy pathologies. So if the HCG is positive, so we are looking now for pregnancy. First of all, we'll check the endometrial cavity. As in this patient, the endometrial cavity is clear with no gestational sac. Keep in mind that in early pregnancy, less than 4 weeks gestational age, the gestational sac may be so small to be seen in sonography, and serial beta HCG titer and follow-up sonography would help us to find gestational sac and normal pregnancy. But if the HCG is high, especially if it's more than 2,500, we should be able to see gestational sac in endometrial cavity, and if not, we will check the adnexa. In this patient, in right adnexa, we can see the right ovary, which is intact with no mass or cyst. Here is the right ovary with no mass or cyst, and few follicles are also seen inside the right ovary. Adjacent to right ovary and separate from right ovary, we can see a cystic structure with thick echogen walls containing a structure so similar to yolk sac. So how can we understand if it's ectopic pregnancy or it's corpus luteum of pregnancy? We know that more than 90% of ectopic pregnancies are tubal pregnancies, and so we will find them separate and outside the ovary in transvaginal sonography, which is the criteria against corpus luteum of pregnancy, which we find it inside the ovary. So in this patient, the right adnexal mass is ectopic pregnancy. Other findings of ectopic pregnancy, such as tubal ring sign and ring of fire sign, are also seen in this patient. But ring of fire sign, which is the vascularity around the ectopic pregnancy, is not always seen, and it also may be seen in corpus luteum of pregnancy. Now let's investigate the left adnexa in this patient. We can see the left ovary here containing few follicles. And again, we can see a cystic structure in left ovary, which is locating inside the left ovary. If we use color Doppler sonography, we can see again ring of fire sign around the cystic structure in left ovary. But as it is locating inside the left ovary and not separate from left ovary, and as it has no tubal sign or echogen wall, it is corpus luteum of pregnancy and not ectopic pregnancy. At the end, keep in mind that rare cases of ectopic pregnancies can also occur in ovaries. If the video was helpful, please like it, and if you have any question, be free to ask it in comments.